There's a video that we have, I won't show it now, called All Over 4, where we place 2 GoDirects, 2 implants at an angle with angled screw receiving abutments, with angled abutments that come in 30 and 15 degree that you can screw in a GPS top into for All Over 4. Here's the 2 GoDirect implants in the anterior, or they could be 2-piece implants with GPS abutments, putting in the angled base, screwing on the GPS platform, the 4 attachments are then attached to the patient's existing denture or transfers. And here's a case using 4 implants and GPS attachments. Another procedure is with the Screwindirect implant. Let me show you the packaging on this. This implant comes on a orange carrier that is a transfer. Also in the package is a white transfer, a snap-on comfort cap, and a 2mm extender in case the tissue is thicker. Now, if you use the extender, then you would use the white transfer to let the lab know what analog to use. So that's why it comes packaged that way. I'll show you some cases with this. So here is the Screwindirect implant, 3mm widening to 5. It comes in 3/7 and 4/7 and 5/7 as well. 5 different copings that attach to it. Gold, titanium, plastic and gold, and a titanium temporary cylinder. These can be 40 degrees divergent and you can still seat the bar. So here's a jaw, lay a flap, place the 4 implants, snap on the comfort caps and suture. After it's healed, snap on the transfers, or you could do it the same day you place the implants. And here's the implant sticking above the crest of the bone. That's where the crest of the bone is. And this close-up shows you what a nice transition with a 1-piece implant. Why put an implant and then attach an abutment when you can have it all in a 1-piece implant without any junction between the abutment and implant? And this was a gold bar with attachments on the distal. Here's another case, extracted the teeth, put 5 of these Screwindirect implants in, attached titanium cylinders, take the patient's existing denture and drill holes in it and slip it over these and attach it with a cold cure acrylic, 4 teeth in a day. And there it is. These titanium cylinders attached to the patient's existing denture. Here's a case with a very thin ridge. The dentist placed 5 of the 3mm Screwindirect implants. You can see how thin the ridge is. He really should have flattened that ridge right to here and not wasted the time and money with bone grafting. He had a mountain of bone that he could have placed those implants in. Then you attach these titanium sleeves. You mark on the denture where you need to drill the hole. You lock these sleeves into the denture with cold cure acrylic and make a temporary restoration that you can deliver the same day. So this is what he started out with. And these are the 5 implants. There was a mountain of bone below that he could have dropped the implants. Another case with 7 Screwindirect implants, made a surgical guide, primarily just to locate mesiodistally where he wanted to place the implants. This time, this dentist flattened the ridge, initiated the placement of the implants, placed 7 implants. 5 right here would have been adequate for this case. 2 more are even better if you have available bone. Suture. Wasn't trying to cover over him, just sutured to oppose the tissue. Then he used blue mousse in the patient's existing denture to seat it and to locate where to drill his holes to convert that to an immediate restoration. Seated the denture, trimmed up the flange of the denture, and delivered the case for teeth in a day. Here's a more sophisticated approach with surgical guides, 6 implants, snap-on transfers, and in the upper 7 of these with the surgical guide,